Alright, I've checked my physician's orders and I've performed hand hygiene, and now I'll select all my equipment for the IV push. And we are giving furosemide. There's some Madonna sterile, or not, regular gloves. Get an alcohol pad. Clean the top off of my furosemide valve. Now I'll get 8 mLs of air. Inject that into the bottle. And withdraw 8 mLs of furosemide, which is equal to 80 milligrams. Scoot my cap back onto the needle. And now I'll label my syringe. Saying that it is 8 mLs of furosemide. And then take off my gloves. Alright. Now I'm walking into the patient's room. Can you state your name and date of birth for me? I'm gonna make sure I wash my hands prior to. And the patient state their name and date of birth. And now I'm making sure that the IV site is patent and there's no signs of infiltration, edema, or phlebitis. Okay. And now what we're going to be doing is I'm going to be giving furosemide IV push through your IV site. And what that do is going to kind of help you excrete a lot of fluids. It's going to make you pee. Alright, I'll be done. Gloves again. And I've checked to see if furosemide was compatible with my infusing solution, which is normal saline, and it is compatible. So I'll just be using one of the ports on the IV line. Alright, I'm going to clamp it. I'm going to clean the top of this and pour it. Alright, I'll be using the push pause method, and I'm going to be infusing this 8 mLs over 4 minutes. And whenever I pause, I'm unclamping the line to let it flush. Pushing. And now if the IV fluid was not compatible, what I do is I just clamp the line, connect a flush of normal saline, flush it, connect my furosemide, and then do it over 4 minutes, and then flush again. Alright. And then if I was going through just the INT, what I would do is I would get my flush and I would put it on the INT, aspirate for blood, flush it, give my medicine over the same technique for 4 minutes, and then flush again. And while I'm doing this, I'm monitoring the patient, make sure they're tolerating it. I'll dispose of my syringe, the sharps. Alright, and now I'm going to be doing my IV piggyback, and now I'm looking at the IV solution. I've verified my physician's orders, and I've washed my hands, And this medication has come pre-mixed, and it is Zosyn, and I'll be giving this over 6 drops every minute. And I've done the calculation as well. And I have my medicine and my piggyback tubing. Okay. I walk into the patient's room, I perform hand hygiene, and I'm going to identify the patient, say name and date of birth, and they got that correct. Alright, now what we're going to be doing is I'm going to be doing a piggyback of Zosyn, and that's just going to be going off your main IV fluid, which is normal saline, and they are compatible, so I'm able to connect it to this. And that's an antibiotic. Alright. And again, I'm making sure that the IV is patent, that there is no edema, phlebitis, or erythema. I'm just going to go ahead and stop this infusion. Before I spike this, I'm going to go ahead and lower my primary tubing, or primary infusion. Let me go ahead and clean the port that I'll be using. During this, I'm making sure not to touch the end of the bag or the needle, or the whatever it's called. Making sure to maintain sterility. Priming it. Okay. I'm going to clean the port that I'll be using in the lining. And I'm going to be getting rid of the air in the tubing doing the reverse method. So I'll just let the tubing and hang it. And I'm going to be counting, making sure that my drop factor is 6 drops per minute. Alright. I'm going to unclamp the tubing. And throughout this, I'm making sure that the patient is tolerating the procedure. And then I'll document appropriately for the IV push and IV piggyback.